Good morning to you. Thanks so much for joining us, whether you're watching us on TV or online. I'm Farah Nasser, and we are awaiting the Prime Minister's daily address. He's expected to speak any moment now outside of Rideau Cottage, as he has been doing, and this is ahead of today's virtual meeting of the House of Commons. Now, while we wait for the PM, let's take a look, as we always do, where the numbers stand in Canada to give you a bit of a perspective. More than 72,000 Canadians have now tested positive for COVID-19. More than 35,000 of those people have recovered, but there are still more than 31,000 active cases, and about 2% of those cases are in critical condition. More than 5,300 Canadians have now died because of complications from COVID-19. Let's take a look now at the number of new cases across the country. That gives us an indication on where things stand. A slight increase in both British Columbia and Alberta. There are no new cases in Manitoba. Ontario is reporting 258 new cases. That is the lowest number for the province since March 29th. Quebec is reporting 706 new cases, which is 50 fewer than yesterday. And 4 new cases were identified in Nova Scotia. All of those came from a long-term care home in Halifax. And our global news team is standing by to bring you the very latest on the spread of COVID-19 here in Canada. We have Tom Vernon. He joins us from Alberta as businesses are just hours away, a couple hours away from reopening in Alberta. That's retail businesses, most parts of Alberta. We'll get to that. Our Ottawa Bureau Chief Mercedes Stevenson is also standing by. She's going to give us her expert analysis on what the Prime Minister has been saying in the past few days. And Mike Lecouture has more on Ontario's reopening plans. And he also has an idea of what we might hear from the Prime Minister today. I know we're going to hear from the Prime Minister in just moments, but Mike, maybe we can start with you. What are you hearing from our government officials?
Yeah, we're hearing that he will make an announcement related to help for fish harvesters. There have been numerous in the seafood industry in recent days who are protesting, saying with the health restrictions and the social distancing, physical distancing, that they've had a hard time trying to do their job. So some aid for them is expected to be announced today. Also, we're expecting that the Prime Minister and the Minister of Environment will be announcing the gradual reopening of our national parks and historic sites. Those were closed in mid-March. Even the parking lots were closed, trying to make sure that people didn't flock there to try and gather there. We are hearing that there will be a very slow rollout of which ones can be reopened and when they will be. Don't expect it in time for the May 2-4 weekend coming up just in a couple of days. The government very sensitive to the fact that people want to get outdoors and may flock there if they reopen them this weekend, so it won't happen. It doesn't seem like for at least a couple of weeks, but Jonathan Wilkinson, the Environment Minister, will be part of the team of ministers at noon that will detail some of those plans, how they will do that. But it's a signal by this government that, look, we are going to start to get things going again here. Even though it's gradual, even though it's slow, they want to make sure that there is that light at the end of the tunnel, that Canadians, will see that there is progress coming here. And frankly, with the summer coming and people wanting to get out and different provinces relaxing their restrictions, the government maybe had to make a move here and signal that things are going in that right direction, Farah.
Let's talk about the province of Ontario now. Mike, the Premier Doug Ford, hinted that there's going to be some new information and more easing of restrictions in place. Do we have any idea what that means for the province?
Yeah, we're going to get details of that at 1 o'clock Eastern. Doug Ford will be making some of those announcements. We're hearing that there's a very real possibility of golf courses, campgrounds, and marinas opening for this weekend. There's been pressure, again, as I said, for the May 2-4 weekend to help get people out there. And because people have been itching for that as well, we're also hearing that any kind of retail stores that are not inside malls will be able to reopen. Again, they will have to have those physical restrictions and physical distancing in place, ensuring that both the workers and any shoppers are protected. It may be more difficult for smaller stores, but obviously everybody in Canada now is used to this, waiting outside, lining up outside of a store. And frankly, almost any store you go to, whether it be a small bakery or otherwise, I've been to a few and they have red dots on the floor saying if the red dots are all occupied, then please wait outside. And we're seeing what some have been doing already of curbside pickup, whether or not some stores will continue to take advantage of that. Obviously, the Ford government has felt that there is enough of a roadmap here, because they had set out some markers in April saying that they wanted to make sure that there was a consistent 2 to 4 week decrease in the number of new cases of COVID-19, sufficient acute critical care hospital capacity to respond to potential surges and new waves. And they also wanted approximately 90% of the new COVID-19 cases and the contacts to be able to be, traced within an actual day. Public health officials yesterday had said that, we are on a really good track here. They couldn't say whether or not there was, we're meeting all of those markers, but there certainly is, in Ontario anyways, a steady decrease in the number of cases. So enough that the Ford government feels that they can proceed with this plan, at least phase 1 of this plan.
And I just want to point out quickly, the health minister tweeted just a couple hours ago that they are now gradually reopening testing, or as they gradually reopen, testing is going to be available now for anyone who has symptoms. That wasn't the case in Ontario. They've also said they've almost completed testing in long-term care homes. Of course, we know testing such a big part of this formula, as is contact tracing. There is a province that is far ahead of Ontario, and that is the province of Alberta. Let's bring in Tom Vernon for that. Alberta taking steps to reopen today. In a couple hours, you can get a haircut in parts of Alberta. Tom.
Yeah, that's right. And we're getting to the point where I could probably use a haircut. So in Edmonton and much of the province, north of Calgary and outside of Calgary, the hair salons, cafes and restaurants will be able to open today, obviously with some restrictions when it comes to the number of people allowed inside. Retail stores will be allowed to open again today, ones that haven't been open for a while. Think furniture stores and clothing stores and stuff like that, with strict restrictions in place there. Now, it's not the case across the province. Calgary and the city of Brooks, which is just outside of Calgary, will be reopening in a slower format than here in Edmonton, and that's because there's still more cases there than across the province. Just by comparison, right now in Edmonton there are 61 active cases, while in Calgary there are 990, and in the South Zone, which is where Brooks is located, there are 117. So in those communities, stores will be able to open, but hair salons and churches and places like that will not be able to reopen until later this month. They're worried about the spread of the virus there. They want to make sure the numbers get down. They want to continue testing and track down where these cases are to make sure that we don't see more spread.
Make sure, there's clearly not a second wave and we don't get back to square one. COVID-19 having a big impact on the Canadian beef supply. Tom, 3 outbreaks at 3 separate processing plants in Alberta. Tell us more on where things stand there.
Yeah, and so that's why we're seeing higher numbers in the Calgary region and in the South Zone of Alberta. That's where those facilities are located. So there was a big outbreak at a Cargill plant that was in High River. There were about nearly 1,000 cases linked to that plant alone. The JBS facility, more than 600 cases linked there. Now we're seeing a number of Canadian Food Inspection Agency inspectors have been impacted by that. Now the impact on the beef industry has been quite large. The Canadian Cattlemen's Association says in Alberta alone there are more than 100,000 head of cattle that are ready for market that simply can't get to market because of the restrictions in place at these facilities. Now they have reopened. Now those head of cattle are costing more than $400,000 per day for these ranchers to feed. And they say, look, we need help on that. It was last week or the week before that the federal government announced some support, and the province threw in money as well on a set-aside program to help pay for those feed costs for the cattle and the industry to try and make it through this time as this virus works its way through, and then we stop the spread and lower it and things can resume back to normal. But this is really hitting the industry hard. There's talks of maybe seeing some shortages because of this. The industry says, look, the support from the government is appreciated, but more is needed to be done.
Okay, Tom Vernon in Edmonton, thanks. We talked about Ontario, we talked about Alberta. Let's talk about Canada as a whole. We're going to bring in Mercedes Stevenson, and specifically about finances. Mercedes, Canada's AAA credit rating is in jeopardy now due to our soaring federal debt.
Yeah, so when you look at what we can expect in terms of a deficit this year, remember we used to talk about $20 billion and think that sounded like a lot, or $30 billion. Now we're looking at $252 billion. That's the projection of the Parliamentary Budget Officer. He is the watchdog over parliamentary and government spending. So that's a pretty significant number. And there's a lot of questions going forward about how the government will pay for all of these programs they've put out. Programs that in the short term help people to maintain, able to pay rent, able to buy groceries, businesses able to keep operating in some cases, or at least paying people. But it does come at a tremendous financial cost. So how to handle that? Do they look at potentially raising taxes? Do they look at cutting some government spending and government programs? Are they looking at simply just passing this on to the next generation and not taking an aggressive stance towards trying to pay it down? We don't have answers to any of those questions just yet. Now, there was a Bank of Canada press conference this morning where they did what they call a systemic review. And they said that essentially the easing of conditions that's been put in place by the Bank of Canada, the lowering of the rate, has meant that banks have more liquidity. That means those banks have more ability to provide loans and support to businesses and consumers. The question is going to be whether that financial flow continues. There was a big retailer, Judith and Charles. A lot of Canadians probably recognize that name. They're saying that they don't know if they're going to make it through COVID-19 because even though they qualified for the government loan, TD Bank is not approving their loan, and 25% of that loan has to come from a bank. So we may see increasing pressure on banks from the government going forward in terms of trying to get them to engage and make sure that people have that money. Of course, at the end of the day, there's questions about debt, both for businesses because these are loans, they're not freebies, and for people who are taking out more money from the bank to be able to get through this. Not a lot of Canadians have the ability to pay their mortgage for more than 2 months if they don't have sustained income. So there's sort of a question about what happens financially once we get through this short, deep economic shock associated with corona. How do you then turn out of that and start to move forward? So far, the government has been saying they don't really know just yet. I spoke with Carla Qualtrough, the minister in charge of employment, last weekend on the West Block, and she was saying, Robin, that they're basically looking at all options on the table. Now, the finance minister has said they're not looking at raising taxes right away because obviously they want people to recover first. But at some point, the government will have to turn their eye towards how they pay for all the spending.
Okay. There is, when you talk about all this money and you listen to the figures, there's real concern from Canadians about fraud surrounding the CERB. What can you tell us about that and how that process is going?
So basically, anyone who applies initially was getting this, and that extended, we were told, and other organizations also reported that people in prisons were able to apply for this. Now, they were intercepted by the guards. They did not actually get the money, but because it was just an automated process in the effort to try to get this money out as quickly as possible to people who needed it, there's a concern about people who were either already on EI, getting double paid and not transitioning, or people who quit their jobs voluntarily getting this, or people who simply didn't qualify. And what the government has been saying is that they believe most Canadians are honest, but they are saying that there is a possibility there could be up to a 3% fraud rate on this. They're looking at getting that money back next year at the tax year. The question becomes, though, number one, will they be able to actually get that money back if it's already been spent? Number two, should they have stricter requirements in place to verify this? And Carla Qualtrough told us that going forward, they are looking at possibly making that stricter. But there's been some concern, and in fact, the National Post was reporting that there was internal memos suggesting that people should basically process, even if they thought there might be a red flag on a file. The red flag stayed on the file. So that report triggered a lot of concern from people who were saying, wait a minute, it's one thing to automatically process. If you think there's a problem, shouldn't you address that? The minister came out yesterday and said, look, if a file is red flagged or we have concerns, we do require people to call a phone number to try to verify to get more information. And at that point, they determine some people are ineligible for it and they don't get it. But there's a big question about sort of how they're going to get that money back. They have set up a little box if you go to the My CRA on the tax website that you use to file your taxes for those of you who do it online. There is now a little little automated section where you can pay back if you think that you got this in error or you realize you shouldn't have qualified, and they are already getting payments coming back through that. So they say they really believe most Canadians are honest, but of course there's always concern about fraud and concern about whether the government is keeping a close enough eye on it.
Especially as all this money keeps just adding up. Mercedes, I want to get your perspective on something. We have the 2-minute warning, but I haven't heard from you about the border. You know, the Prime Minister obviously did not answer very many questions about specifics. Are you learning anything new surrounding the opening of the U.S. Canada border?
Well, we're thinking it looks like it's going to be June 21st now. That's what the Globe and Mail was reporting, that was their exclusive report, that it's going to be extended to that. It sounds like that is, in fact, going to be the plan. We're still trying to get details on exactly how this works. The big worry for a lot of folks in government has been that Donald Trump will push to reopen the border before Canada wants to. And number one, that could put you at risk for another face-off with Trump, which, as we know, the government does not want. They try to avoid that. They've managed to do a really good job, frankly, in terms of negotiating the border so far and staying out of his crosshairs. But there was some concern about that, or what happens if the U.S. goes ahead and they open the border and say, okay, it's open, and Canada says, well, no, it's not. Well, that would mean that Americans couldn't come to Canada, but Canadians could go to the U.S. and they could bring corona back. So I know that that has been a big concern. Adrian Dix, who's your health minister out there in BC, was warning people, saying, look, if you think that you're going to do cross-border shopping when the border reopens, if it were to happen that the U.S. went before Canada, you're still going to be in self-isolation for 14 days when you get home. So you might not want to do cross-border shopping at this point. But so far, it looks like they still have the Canadian and American governments on the same page when it comes to the border, and that is what they're really hoping to be able to continue to go forward with. There are, of course, essential workers in the food chain continuing uninterrupted, but the pressure mounts too as we get closer to summer, because a lot of people from the United States like to vacation in Canada and vice versa, and at this point, that is not something that you will be able to do until it's looking like at least July. That also fits, Robin, with the projections that I had heard from a number of sources internally and that we'd heard from governments provincially across the country.
You know, we also have to remember there are Canadians who are in the U.S. Right now, Mercedes, who are going to want to come back as well, and they're going to have to quarantine too for 14 days. And Canadians also who are around the world, Mercedes, who want to come back home.
Yeah, absolutely. And by the way, I'm sorry for calling you Farah Robin, as you can see. A lot of coffee, maybe not enough time to slow down and think about some of these massive government programs that we're going through. But, you know, it's really, there's just still so many questions going through with this, Farah, as the government tries to navigate and tries to go forward and tries to find a way around all of this and to deal with it. And the government is looking at how they can try to help the most people possible, but to also do that in a way that stimulates the economy. And that's sort of one of the criticisms and challenges that has come up, is what do you do going forward now to stimulate the economy? Because you've dealt with all of these workers
who
Mercedes,
are out of work. I'm just going to interrupt you because the Prime Minister is just approaching the podium right now. Thanks so much.
Tout le monde. Over the last 2 weeks, we've seen our women and men in uniform step up to the plate again and again. In seniors' homes, in northern communities, they're there for where we need them most. And because they respond to the call of duty without hesitation, whenever they're called upon, it can be easy to forget the toll this work can take. Members of the Canadian Armed Forces have always been there to do tough, dangerous jobs. So after a lifetime of service, far too many veterans live with chronic pain. Today, we are launching the Chronic Pain Centre of Excellence for Canadian veterans at McMaster University. This centre will focus on national research, training and education to provide veterans with the support they deserve. No one, least of all those who have worn the maple leaf, should be without the care they need. Later today, I'll also be meeting with nurses here in Ottawa to thank them for their outstanding work. I know I speak for all Canadians when I say that we are incredibly grateful to the women and men who are keeping us safe right now.
Our men and women in uniform have always been there with us, and we have to be there for them as well. Today, we are inaugurating the Centre of Excellence on Chronic Pain for Veterans at the University in Hamilton, McMaster University. This centre will be looking at education and training to offer veterans the kind of services that they really need across the country. And to all of those who have served Canada, we thank you. The whole country is very grateful, and we are there to support you.
Over the last 2 months, a lot of Canadians have faced very challenging situations and very difficult choices. Just take workers in the fisheries industry. You can't harvest lobster from inside your house. So that leaves you trying to figure out how to either space people out on a fishing boat or cancel your operations. It's not an easy call to make. On top of that, prices and demand have gone down, putting financial pressure on fishers and their families. Taken together, this adds up to a really tough time. So I want you to know that we're listening, that your local MPs are making sure your concerns are heard, and above all, that help is on the way. Today, I can announce that we are investing almost $470 million to support fish harvesters. First of all, we are creating the Fish Harvesters Benefit. If you're expecting a 25% drop in income this season, you'll get support to cover 75% of your losses, up to about $10,000. And as a reminder, if you qualify for the Canada Emergency Wage Subsidy instead, remember that we'll be extending it beyond June. We're also introducing additional non-repayable grants of up to $10,000 for fish harvesters who own their own business and need support to bridge to better times. And for workers who are worried about next year, we will change employment insurance rules so that fish harvesters can apply for EI benefits based on the earnings of previous years. This all builds on the investments we've made for fish and seafood processors. And for farmers and aquaculture fisheries, we're also launching a $100 million Agriculture and Food Business Solutions Fund through Farm Credit Canada. This is yet another option to help agri-food companies facing unexpected financial strain. Whether you're a fisher, a food processor, or a farmer, we've got your back. And I know all Canadians do too. And everyone who wants to show their support, buy Canadian. Pick up some Canadian cheese to help out a local dairy farmer. Have a fish fry or buy Canadian lobster. Not only will it taste great, but it'll help the people who keep putting food on our plates.
Many industries have been going through difficult times, and the fisheries are no exception. Not only are people having to either stop their activity or slow them down to protect themselves and their workers, but prices and demands for seafood and fish have gone down. And this is why we now have this Fish Harvesters Benefit. So if you're a fisher person who is expecting 25% in lower income, then this measure will be there for you. We will cover up to 75% of your losses, up to $10,000. And for those who are eligible to the wage subsidy, then we will be able to prolong that program beyond the month of June, just like we said so last week. And we will also be offering other non-reimbursable grants to a maximum of $10,000 for fishermen who have their own businesses and who need help in order to get through this difficult time. And for workers who are worried about the next year, we will also be changing EI rules so that they can get benefits according to the revenues previously earned in other years. You are the ones who are feeding our families, and we want to listen to what you have to say to help you weather this crisis. We are there for you. I now want to talk what we are going to be doing to help Indigenous peoples who are facing some very specific problems right now. We had $306 million for reimbursable contributions to Indigenous businesses. As to students and Inuit and Métis students, there will be a targeted support of $75 million at willing to help young people find jobs this summer. And for women and children who are fleeing domestic violence, $10 million for emergency supports and shelters. We know that there is still a lot of work to do in that department.
Has been engaging with First Nations, Inuit and Métis Nation leaders in the fight against this virus. In places like northern Saskatchewan that are dealing with COVID-19 outbreaks, it's become very clear that communities need this work to continue. That's why yesterday we announced support for the Meadow Lake Tribal Council and Métis Nation Saskatchewan for their pandemic response plan. Through this plan, we're partnering with communities to provide over $2.3 million for everything from food to supplies. We all want the same thing, to keep people safe, and we will continue coordinating to make sure that happens. I want to end today by recognizing that the May long weekend is coming up. It'll be different than normal because lots of places, including our national parks, are still closed. But this isn't forever. Canadians have been doing the right things these past many weeks, and that's why we can announce today some good news for the weeks ahead. As of the beginning of June, some national parks will be partially reopening so that people in the area can use trails and green spaces where physical distancing is possible. Getting fresh air is important, but we all have to be responsible about it. And we have to be prepared to make adjustments as needed. That's why, with the weather getting better, we're bringing in new regulations on boating as of June 1st to protect vulnerable communities in the north. No pleasure craft will be permitted to operate in Canada's Arctic coastal waters or in the coastal areas of northern Quebec and Labrador. Of course, this ban does not include boats used for essential fishing and hunting or for local community use. Les parcs nationaux vont rester fermés en fin de semaine.
National parks will remain closed this weekend, but some will open up as of June 1st. You will be able to take advantage of green spaces and walking trails while socially distancing, but we must remain vigilant, and we have to be ready to adapt ourselves to the new circumstances, and this is why, as of June 1st, pleasure boats will not be able to go in the Arctic zone of Canada or in the coastal zones of Quebec, northern Quebec and Labrador. And this is what has to be done in order to protect each other. We have to remind ourselves, though, that this is not forever. And if everybody does their part, we will all be able to get through this. Thank you very much.
We'll now go to the phones for questions from the media. Just one question, one follow-up. Operator.
Thank you. Merci. First question, Janice Dixon, The Globe and Mail. Line open.
Hi, Prime Minister. My question is about the Canada-U.S. border. A Canadian and an expectant mother living here says border guards have twice refused her partner, an American citizen and the father of her baby, from crossing into the U.S., and the border guards told him being here for the birth of his son was non-essential. Do you think someone in this circumstance should be able to cross?
We know Canadians are making extraordinary sacrifices through this difficult time. Loved ones who are saying goodbye to their parents and grandparents via FaceTime because they can't see them in person. People living through very difficult distancing that is causing a real impact on people. Obviously, we're trying to make sure that people can do the things that are most essential. But even as we were grieving over the past weeks in Nova Scotia and elsewhere, we needed to make sure we were respecting the rules in place to keep people safe. I can understand the difficulty and the challenge that closing the borders to all but non-essential travel is causing on many, many families. We need to make sure that the decisions are taken that are going to protect people. I understand that different decisions could be made on a case-by-case basis, but what we are doing now is what we need to do to keep Canadians safe for the coming months and years.
A follow-up, Janice?
Yes, the American man I mentioned was told by an officer that the only way he could see his son is if his expecting partner was hit by a car and they needed someone to take care of the baby. Is there not any room for compassion in these cases? He wants to try again after his son is born. Do you have any advice for this specific example?
So we've seen families split up even internally in Canada because of COVID-19. It is difficult on everyone, and I can't comment on every case, obviously. But I do know that Canadians from coast to coast to coast are making tremendous sacrifices in order to protect their loved ones, their communities, their parents, their grandparents, and preventing our healthcare systems from getting overloaded.
Thank you. Next question, operator.
Thank you. Merci. Next question, Jenny Pashagumskum, APTN. Line open.
Hi, thank you, Mr. Prime Minister. You mentioned something in French about Indigenous students and Indigenous women. I'm sorry I missed it. I was expecting a translation. Could you tell us what was said there?
We're making sure that students in First Nations, Métis, and Inuit communities get extra support. We're also investing in support for families, women and children fleeing domestic violence in Indigenous communities. We've made a large number of investments in supporting Indigenous communities across this country through this pandemic because we recognize the level of vulnerability. And I can tell you that Minister Miller will be at the noon update, as he is every week, to highlight the initiatives we're moving forward on with Indigenous communities.
Follow-up, Jamie?
Yes. My follow-up is concerning the rapid tests that were supposed to be coming out a couple of weeks ago. I know Indigenous communities have tests, but they're not the rapid tests. What happened to that?
As was highlighted a number last week, I believe, there have been challenges around the rapid test that I believe an Ottawa company had put forward. They've gone back to try and improve them or repair them. We've seen many new technologies come forward in terms of helping, and we've moved very quickly on them, but it also requires us to adjust when things aren't working exactly the way they were hoped to be working. So I know people are working very hard to make sure that Indigenous communities and indeed remote northern communities get the testing capacity they need as quickly as possible, but we need to make sure they are reliable tests.
Thank you. Operator, next question, please.
Thank you. Merci. Prochaine question, Catherine Lévesque, La Presse canadienne. À vous.
Oui, bonjour, Monsieur.
Catherine Lévesque from Canadian Press. Good afternoon, Mr. Trudeau. I wanted to come back onto the wage subsidy that's going to go prolonged after June. Can you tell us how long it will be extended? I think we'll have more to say tomorrow about this. Businesses throughout the country want a certainty so that they can rehire their workers and know how they'll be able to function as the economy reopens. And of course, the wage subsidy is a very important tool to maintain the link between employers and employees, and it will allow us to relaunch the economy more efficiently. So yes, it will be extended, but we will give you more details soon. Follow-up?
Qu'est-ce que vous dites aux Canadiens qui se demandent quoi faire de leurs vacances cet été? Devraient-ils rester au Canada?
So what do you have to say to Canadians who want to plan their vacation this summer? Should they stay in Canada? Should they be allowed to travel from one province to the other? What's in the forecast for them? Listen, we all want to know what's going to happen in the coming weeks and the coming months. And the only thing that we do know is that right now it's important to take all the necessary precautions, such as social distancing, staying at home as much as possible, to protect ourselves. And that's the way that we will make sure that we can emerge from this crisis as quickly as possible. So decisions that families will make this summer are going to depend on the region in which they find themselves, the rules specific to that area starting in July. So it's a bit too soon to be able to say what the situation will be. We do know that it's not going to be a summer as usual, that's for sure. It's going to be a situation where individuals and families are going to have to make decisions based on very different constraints than what they'd imagined 6 months ago.
Thank you. Merci. Prochaine question, Louis-Samuel Perron, La Presse. À vous.
Next question, Louis-Samuel Perron from La Presse. Yes, good afternoon, Mr. Trudeau. Will national parks in Quebec open on June 1st, and what are going to be the criteria for reopening of the parks? Well, as you know, throughout the country, the situation differs. We will combine the federal parks and provincial parks opening dates. We will synchronize them to the extent possible. We will look at the decisions that are taken by the various regions where the parks are located. For example, in the far north, parks that are close to Indigenous communities are not going to be opening on June 1st. It's unlikely. Other parks that are more accessible and less problematic may open. So we'll have more to say in the coming weeks as to which parks are going to be reopening. But our objective is going to make sure that we align with the decisions made by local authorities concerning national parks and historic sites.
The pandemic has hit very differently across the country, and therefore there will be different phases or different steps in reopening of national parks across the country. We will try and align with the local jurisdiction what the provincial parks nearby are going to be doing so that it is clearer for people in terms of what they can do in their own particular region. But for example, our Arctic parks won't be reopening anytime soon. Certain parks that are in close proximity to Indigenous communities will take a little longer to open because of vulnerabilities. We will have more to say in the coming week in terms of which parks will be opening up. But we know people are going to want to get outside. They're going to want to do that safely. So as of June 1st, we will be facilitating that to a certain extent, always staying careful and responsible in the way we do it.
Suivi?
Yes,
Mr. Trudeau, we learned this morning at the National Post that ESDC Canada is asking civil servants to approve the Canada emergency even in the case of Canadians who have been fired or refused to work. Well, people remember the employment figures or unemployment figures that we posted last week. Millions of Canadians found themselves without work over the last few months. And so we had to make a choice as a government to either help these people and to help them quickly. And that's what had to be done. Now, if we'd made sure that there would have to be a complete investigation of every person's request, that millions of people would still be waiting to receive the Canada emergency benefit. Now, we know that 99% of Canadians that are requesting this help really need it. And so it's not because of the 1% of fraudulent applicants that we should slow down or paralyze the system and prevent millions of Canadians from getting the help that they really need. So we have put measures into place to counter fraud attempts, and we will make sure that there are controls done over the next few months. But the priority at first was to help Canadians who needed this, and that's exactly what we did.
I think people remember well the job numbers that came out just last week that showed that millions of Canadians have lost their jobs. We made the choice as a government from the very beginning that we would help those millions of Canadians. And getting that help to 99% of the Canadians who needed it quickly and rapidly, if it meant even accepting that 1 or 2% might make fraudulent claims, was the choice that we gladly made. We needed to get help to Canadians immediately, and that's what we did. If we had asked the public service to perform background checks on everyone applying for the CERB, we'd still be waiting to get those checks out. And people needed that money. Now they needed that money last month when we delivered it. So saying, we have put in strong measures to ensure that anyone who is trying to defraud the system will get caught and there will be consequences. But that was not our priority. Our priority was helping people immediately, and the fraud measures will kick in the coming months.
Kevin Gallagher with CTV News. Could you expand on what those measures or mechanisms are? And also, you said yesterday the CRA would be responsible for a lot of that with the CERB. They're also responsible for the wage subsidy. So is the CRA going to need more resources to tackle the potential fraud that has come from these vital federal programs during this pandemic?
Well over 7 million Canadians have applied for the CERB. Millions of Canadians are receiving the CERB. Millions of Canadians have lost their jobs. We needed to help them rapidly and efficiently. That means to get the CERB, people simply needed to fill out an attestation to make commitments that they were in a situation that they deserved to get the CERB. Of course, there's going to be a few people who will misrepresent themselves and try and defraud the situation. Defraud the situation. But we know that the priority was getting help to people who needed it. And that's exactly what we did, including by increasing the capacity of the federal government to deliver these checks and support CRA and other government workers. The choice we made was to get the money out to people immediately when they needed it, so we could do the social distanciation, so we could stay home in the way we needed to, and make sure that the fraudsters get caught as we move forward.
It didn't really answer if there was going to be more resources for the CRA to do this. I'm also wondering, as provinces start to reopen their economies, non-essential businesses start to open up, there are likely to be workers that are concerned about returning to work for their own safety. Either they're immunosuppressed, they have difficulty finding adequate childcare options, or perhaps they're unsatisfied with their workplace safety protocols because of the coronavirus. Will those workers have an option to remain on the CERB, for example, or other federal programs? What will happen to workers that have concerns over their safety but now might have to go back to work?
On the first part of your question, the measures we've put in have required the public service across this country to step up in extraordinary ways. And we're making sure that they get the support they need as they deliver in a rapid way, in a reliable way, the support that millions upon millions of Canadians are needing. And we need to thank them for the work they're doing. And of course, we will always make sure that they have the resources necessary to do the things that Canadians need them to do, and do them as incredibly well as they have been. As the economy begins to reopen, as people start looking at going back to work, there are going to be lots of questions about safety, about childcare, about next steps. And we're going to work very closely with the provinces, with industries, with employers, with people to give as much clarity as we possibly can. We're in an unprecedented situation. We're figuring this out step by step as we move forward, as we get into the next phases of this. But every step of the way, our focus is going to be on keeping people safe first and foremost. That needs to be the priority that all Canadians put at the top of the list.
En français, s'il vous plaît, sur la sécurité des travailleurs.
In French, please. Over the coming weeks, there are going to be lots of questions as to how we can gradually reopen the economy, how people can return to work, and what is going to happen with people's individual concerns. So we're going to be working together to find solutions to these questions. We are in a situation that is without precedent. There are no easy answers. We will cooperate with the provinces. We will be listening to Canadians and their concerns, and we will be looking for the best way to ensure their safety while fostering a gradual relaunching of the economy. Mr. Goyer from Radio Canada. Mr. Prime Minister, we see that the wage subsidy is much less used by employers than what had anticipated. So, the crab seems to be relied on much more than a wage subsidy. So shouldn't that be prematurely ended? We know that there are millions of people that lost their employment and had no income. So we know that the crab was very important. But at the same time, we said that we're hoping that the wage subsidy is going to will encourage employers to rehire the employees that they've laid off, and that this will help relaunch the economy. We know that maintaining the link between employer and employee is one of the best ways to ensure that economic reopening will be effective and efficient. Well, couldn't we make the crab a bit more like unemployment insurance so that they could earn up to $1,000 and still get a part of the benefit? Well, these are issues, of course, that we're examining right now. All of these issues are relevant in the context where we are looking to reopen the economy, going from a situation where people are confined at home to a situation where they return to work and economic activity slowly resumes. So we will have to modify some of our programs, but these are all questions that we are looking at right now. For the time being, we're still in emergency mode. We are looking to support people so that they can stay home and that we can stem the spread of the virus. But as soon as we reach the next steps, we will be modifying the programs. Now, how exactly? Well, that remains to be seen. For the time being, we're going to keep the wage subsidy because that's key to making sure people can go back to work.
Earlier about workers and safety. More than 40 inspectors with the Canadian Food Inspection Agency are getting sick going to work in meat packing plants. I'm just wondering what the federal government is doing to protect these inspectors.
No, we know the situation is extremely difficult in many meat packing plants across the country. That has been a real challenge, and we always are trying to find that balance between assuring a safe and reliable food supply for Canadians, which is fundamental and necessary, while at the same time ensuring the protection of the workers who are there. That obviously includes the food inspectors, and we need to make sure that they have access to the right kinds of personal equipment, protection equipment, and the right conditions to keep them safe. As important as it is to keep our economy going and get food on the table, we also need to make sure we are prioritizing worker safety.
The union, just to follow up on that, the union representing these meat inspectors, they say that they've been giving a work or else order from the agency, and if they refuse to go to work, they will be disciplined. So I'm just wondering why they're being ordered to go to work if they don't feel safe.
I think getting that balance right is extremely important. We need to ensure that essential services like the food supply continue to flow to Canadians, but we need to make sure we're doing everything we can to keep workers safe, and we will continue to work with Labour, with industry, with provincial partners to make sure that both of those things are being done. Okay.
We know that it's important to maintain the food supply chain and to make sure that we provide safe food. It's also important to ensure the safety of all our workers. So we will continue to work with the unions, with industry, with employers, with the provinces. We will do everything in our power throughout the country to make sure that everybody is allowed to work in safe conditions.
The WHO's emergencies chief, Dr. Michael Ryan, he was quoted today saying that this virus may never go away, that it could become just another endemic virus in our community. So I want to know, as a government, how do you plan for that kind of scenario? And you're loosening up some restrictions on national parks today. What do you say to Canadians who might hear this and think, well, things are never going to get back to normal?
I think we know that there are things that we took for granted last year and years before that have changed. We have seen this world change rapidly over the years. You used to be able to get on a plane without taking off your shoes first. We have seen measures brought in that have made shifts in our society, some for the better, some for the worse. COVID-19 will be one of those things that creates changes in our society. Our responsibility as a society, as governments, is to try and figure out how to minimize the negative impacts of those changes while maximizing the safety of Canadians. There will be adjustments, but reopening national parks, for example, on June 1st means that we know that you can't prevent Canadians from going outside when the weather is nice. You just have to help them do it safely. Continue to impress upon them the need for physical distancing, recognize that certain areas are more vulnerable than others and will need to remain closed, but create opportunities for Canadians' well-being, for their mental health, while at the same time protecting their physical health. Getting that balance right is something we're doing in the short term, but obviously there'll be plenty of reflections over the coming months and indeed years about how we make sure that Canadians and people around the world are kept safe from this pandemic or from potential next pandemics.
So we have to recognize that there are things that are going to change in our world, even after this pandemic is over, even once a vaccine is developed. The lessons we've learned are going to make our behavior change as a society and as a planet. At the same time, our responsibility as a society, as a government, is to minimize this kind of upheaval or disturbance while ensuring the complete safety of citizens. This is the kind of balance that we wish to maintain with respect to national parks. As an example, we will be able to open a number of national parks on June 1st, but of course we're going to be encouraging people to maintain physical distancing. But it's a good thing to go outside, to get some air, and to move about. It's important for Canadians' welfare and mental health, but we want to make sure that it's done safely so that vulnerable populations are not put at risk. Of course, we're going to have to think about how we're going to behave over the coming months and the coming years, whether we find a vaccine or not. But for the time being, we are making the best decisions that we can to ensure the best quality of life and the safety of all Canadians.
I'd like to ask you about something that happened on Sunday in Saskatchewan. A First Nation there says that the RCMP interrupted an important ceremony over concerns about physical distancing. Premier Scott Moe says there can be no exceptions to the province's rules about public gatherings. What do you say?
I think Indigenous community leadership knows that we need to be keeping people safe, and we should be able to work with them to develop ways of continuing with important customs and practices for them in a way that abides by health recommendations. I think that's something for the leadership of the community to take on, and we, of course, will be happy to work with them. Merci beaucoup tout le monde.
Thank you.
That is Prime Minister Justin Trudeau. His announcement was about parks reopening June 1st, some national parks. We also heard about some money for the fisheries industry and for Indigenous communities. But I want to focus first on something that he said is coming tomorrow. Let's bring in our Michael Couture and Mercedes Stevenson for that. We heard that we can expect more on the wage subsidy. This is the government's costliest program. I just looked up the stats. The dollar value of subsidies paid out $3.36 billion thus far. How long do we know? Could it be extended? And what will that mean? And Mercedes, I'll start with you.
Yeah, so we actually asked Minister Qualtrough this question on the West Block last week because it was set to expire on June 6th, and there was already companies that were getting ready to hand out layoff notices. What she said is that they are looking at expanding it. It will go beyond June 6th, which we knew. And I said to her, have a sense, are we talking like days, weeks, months? And she said they believe that they're looking in the order of months. So we still don't know exactly how long that may be, but with economies just reopening, a lot of people can't go back to work right now, even if they want to on the CERB. The wage subsidy is sort of the same question. If economies aren't reopening, then those employers may not have another source of income and need that. Then again, these are very expensive programs to operate. So the government has to find that line between making sure that people are are supported and that companies are supported, but at the same time that as soon as they're able to get back on their own feet, they're able to do so. And that's where they've talked about bringing in potentially more restrictions, in particular on the CERB, on who's going to qualify. For example, if you're on unemployment insurance, you have to demonstrate you're looking for work. So they might look at bringing in things like that to tighten it up a little bit, or to tighten up who qualifies. And with the wage subsidy, it'll be interesting to see if they just kind of cut it off, or if it's something that they slowly wean businesses off of as the economy reopens.
The other thing that was asked about was fraud. I know we addressed that, Mercedes, right before we went on air. Mike, let's bring you in on this and what the Prime Minister said surrounding potential CERB fraud and consequences for those who take advantage of the system.
Yeah, he basically said, look, we knew going into this that if we were going to get the money out the door quickly, that this was going to be one of the things we were just going to have to deal with. I'll read a little bit from what he had said here, basically saying we made the choice to help those Canadians, the 99% of Canadians, quickly, even accepting that 1 or 2% of those claims would be fraudulent, just so that we could take care of those 99%. Kind of an admission here that they knew that the system might have been open to fraud and that they were just going to deal with it at that point. And I think that, the government has been pressed on many occasions, especially by the NDP. Jagmeet Singh has said that the CERB should be open to everyone. And then in the next tax season, that auditors just go through it and see who may or may not have been eligible for it. And a bit of an admission here, or now that we're seeing this story come out, that maybe that would not have been the best idea, because more people possibly would have tried to take advantage of it. And the Prime Minister basically saying, we are doing our best here. We are trying to get the money out the door as quickly as possible. Also saying, if they had had people doing background checks at CRA for every one of these applications, we would not be at the 7+ million Canadians having the money in their bank accounts or in their pockets right now. We would still be trying to get checks out the door. So from the beginning, the government has said speed, not perfection, is the goal here. And that is what business groups have said, and that's what they have responded to. So it seems like they're comfortable with the 1 to 2% of fraudulent claims, and now how they will try and get that money back, that's a whole nother problem that they'll have to deal with.
Yeah, and why they can't just investigate blatant cases of fraud. But of course, he didn't answer about specifics in terms of resources that the CRA could have to do that.
I think, Farah, in all honesty, you've had a lot of these people who have come in either from retirement, or they've got people from other departments to come and work on the CERB specifically to get the money out the door. Will those people who are now there, and maybe as it continues, and I know, as Mercedes said, we're going to be extending it for a little bit now, will those people, now that the rush is over, be redeployed into investigative work? I mean, that is something that I think they're possibly looking at. It was one of those things where I think it was rush as many people towards the problem as they could, get the money out the door, and now sort of sit back and go, okay, there were some mistakes. Can we recoup some of that money now? That may be where they turn their attention to.
Of course, this kind of thing has never been done before. Mercedes, I want to talk to you about something you also spoke about at the West Block on your show. Some workers that are coming to work but don't feel safe, because we know that this hits people who have compromised immune systems, the elderly, people who are still working, past 65, 70. So what did the Prime Minister say about those workers who are concerned as economies reopen?
Well, he says that they are putting safety first. I mean, I think the interesting sort of twist on this could be what happens when those industries are provincially regulated and not federally regulated. And if you are unable to return to work because you are immunocompromised, or maybe you look after someone who's immunocompromised, or you have a particular health reason why you can't come back, if your employer has to keep your job, can they lay you off? What happens then? What if it's not the workplace that's the issue, but it's getting on public transit to get there? There's a lot of really interesting things going forward, I think, in terms of how labor will work after this. Federal government is saying, look, safety is first. Okay, does that mean you can stay on the CERB even if you can get a job, because it would require you to take public transit, and that could expose you and that could compromise your health? I think there's a lot of really interesting questions there about how that's going to work, and how employers can be creative with allowing people to continue to work from home when when they can, and also how the federal government will deal with it if employers are not taking those serious, not just health concerns, but actual health issues into consideration. And there are a lot of folks out there who either have them or who are directly caring for an elderly parent or a child or someone in the home who might be vulnerable if they bring home COVID-19.
That's a concern. And the other thing, that we have to think about too is as some people return to work, there's others who can't return to work, those who work from home. There are some that cannot work from home. And often those are people who are from poor communities too. So what the class divide is there as we move forward. And some people have an office from home where they can work, and some people who obviously are doing other work that they can't. So that's something else that we'll be hearing about as we hear about the wage subsidy tomorrow. Michael, let's end with you. Anything else that stood out for you from the Prime Minister's address today?
Well, I think it was near the end when he was asked specifically about the World Health Organization, their admission that COVID-19 is one of those viruses that might just stick around. And the Prime Minister said, look, COVID-19 will be one of those things that creates change in our society, saying, look, before 9/11, you didn't have to take off your shoes to get onto a plane, and COVID-19 will be one of those things that will just change our daily lives.
Yeah, as we move forward, of course, it already has changed and will continue to evolve and change. I just want another note for our Ontario viewers. The Premier is expected to speak at 1 o'clock. He is now going to be speaking at 1:30 in case you want to tune in for that. Thank you to all of our correspondents today, to Tom, Mike, and Mercedes. Here is a quick recap of what we heard from the Prime Minister for you. $470 million to support fish harvesters, saying if producers are expecting a 25% drop in income this season, they're going to get support to cover 75% of the losses up to $10,000. And we also heard the gradual reopening of national parks beginning June 1st. Thanks so much for joining us and making us a part of your day. We now return you to your regularly scheduled programming.
Bon après-midi à tous et à toutes.
Good day, everyone. We are here today mainly over teleconference with Minister Jordan, Minister of Fisheries and Oceans, Minister Wilkinson, Minister of the Environment, and Tom Wong, Chief Medical Officer of Indigenous Services Canada. We will speak in the following order: Minister Jordan, Minister Wilkinson, Dr. Wong, and finally myself. Without further ado, Minister Jordan, please.
Bernadette. Minister Jordan. Okay. Let's go straight to Minister Wilkinson, and we'll go back to Bernadette. Minister Wilkinson.
All right. Thank you, Mark. Bonjour, hello. The Prime Minister announced this morning that of services at several national parks, national historic sites, marine conservation areas, and wildlife areas on June the 1st. The limited openings will align with guidance provided by respective provincial health authorities. It will not apply to all parks, so it will be important to check for the status of your local park. Ces ouvertures viseront à permettre
These openings aim to enable locals to use and enjoy parks near their homes. With spring coming, it is important for Canadians to have spaces where they can exercise and discover nature in a manner that respects physical distancing requirements.
We all know how important it is to get outside and to be in nature. It is good for our mental and for our physical health. This partial reopening will allow visitors to have access to trails, grounds, day use areas, and green spaces where physical distancing is possible. Limited facilities such as washrooms and comfort stations will also be made available to visitors. I would emphasize that services will be very limited to begin with. As we move forward, we would hope to expand the range of available services, but this must be done in a thoughtful and a prudent manner, one that is consistent with putting priority on the safety of Canadians and, of course, on our Parks Canada staff. We must enjoy these places safely and follow the advice and guidance of public health experts. People should check ahead on the websites to plan their visit and prepare appropriately. Certainly follow us on social media for just-in-time updates. Thank you very much. Merci.
Okay, we'll go back to Minister Jordan and see if everything's working. Bernadette? Over to you, Minister Jordan.
Well, thank you. Good afternoon. Hello, bonjour, quoi. The women and men who work in Canada's fish and seafood sector are the economic drivers of many of our coastal, Indigenous, and rural communities. They've been feeding Canadians for generations, and we need them to be able to continue to do so safely in these very challenging times. While hardship and uncertainty is felt across the country, the fishing sector faces challenges that are unique, and they require direct solutions. That's why today, our government is announcing $469 million in funding to establish the new Fish Harvester Benefit and the Fish Harvester Grant. This is the single largest investment to Canada's fisheries in nearly 20 years, ensuring that Canada's hardworking independent fish harvesters get the support they need now and while positioning the sector for a strong recovery. The new Fish Harvesters Benefit will provide up to $267 million income support for eligible self-employed fish harvesters and chairperson's crew who cannot access the Canada Emergency Wage Subsidy. Support will be provided to those who experience losses of 25% or more during the 2020 tax year, up to a maximum individual equivalent of $847 per week for up to 12 weeks. The new Fish Harvester Grant has dedicated funding for up to $201 million in non-repayable support to licensed self-employed fish harvesters who cannot access the Canada Emergency Business Account. They can use these funds to cover the costs of running their fishing businesses, including increases in costs due to the health and safety requirements. Lastly, we will also launch EI rules so that fish harvesters can apply for EI benefits based on earnings from last year. We'll support you now and into the future. We continue to assess and respond to the impacts of COVID-19 and take additional actions as needed to support Canadians, stabilize the economy, and mitigate the impacts of this pandemic. Canadian harvesters are resilient and determined, and today I am urging Canadians to show their support by purchasing more of our high-quality, sustainably sourced products at your local grocer. There's never been a better time to buy a Canadian fish and seafood product. Our harvesters, many of who will be heading out for their spring season tomorrow, can continue their vital work knowing that the Government of Canada is here to support them every step of the way. Thank you. Merci. Walalan.
Merci, Madame la Ministre. Tom, Chief Medical Officer, Indigenous Services Canada.
I want to acknowledge that we are on the traditional territory of the Algonquin people. As of May 13th, a total of 185 cases have been reported among First Nations living on reserve in provinces. This represents less than 0.3% of reported Canadian cases, whereas First Nations on reserve in Canada constitutes about 1.5% of the Canadian population. Of the 185 cases, 63% have recovered. 18 cases, that is 10%, required hospitalizations. And there have been 2 deaths on reserve. The First Nations on reserve case fatality rate is currently at 1% and is below the Canadian overall case fatality rate of 7%. We are cautiously optimistic that nationally, the First Nations on reserve curve continues to show signs of flattening if there's no future spread of COVID in First Nations communities. This has been accomplished by impressive First Nations leadership and decisive actions in using public health measures, including lockdown, physical distancing, prompt isolation, avoiding crowds, hand and cough hygiene, and it has paid off. Beyond infections in First Nations living on reserve, there are many more cases elsewhere in Canada involving First Nations, Métis, and Inuit, with COVID-19 being reported to the provinces and territories. Timely epidemiological data collected by Indigenous Services Canada is only available for First Nations living on reserve. We need help from provincial and territorial health departments and agencies to support Indigenous peoples to get a comprehensive epidemiological picture beyond First Nations on reserve. As different jurisdictions are entering into the early stage of reopening of the economy, it is important to recognize the inherent rights and self-determination of First Nations, Inuit, and Métis people. Communities will decide what is best for them in the unique context of remoteness, access to health services, living conditions, and the prevalence of underlying medical conditions. Les communautés décideront de ce qui leur convient.
Communities will decide what suits them best in the context, the unique context of remoteness, access to health services, living conditions, and the prevalence of medical conditions. However, we must remain extremely vigilant during the gradual reopening of the economy in order to prevent introduction of this virus to Indigenous communities.
Merci, merci, and thank you.
Thank you, Tom. As today is Indigenous Nurses Day, I would like to begin by saying thank you, merci, miigwech, marcy, nakumik, hi nyawan, Wilalin, Haijka, Marcy Cho, to all First Nations, Inuit, and Métis nurses for their incredible work caring for patients and providing culturally safe healthcare during the COVID-19 pandemic. As we are learning from past experiences responding to pandemics in Canada, and specifically in First Nations, Inuit, and Métis communities during the H1N1 virus, we need to recognize and understand that they have a higher risk of being disproportionately affected by COVID-19. The First Nations and Inuit Health Branch continues to provide effective, sustainable, and culturally appropriate health programs and services that contribute to the reduction of gaps in health status between First Nations and Inuit and other Canadians. And I would like to remind everyone that improving the health of Indigenous people in Canada is a shared responsibility between federal, provincial, territorial, and Indigenous partners. Our goal continues to be to work with all in partnership to ensure Indigenous communities receive the care they need. By working together, we're saving lives. As Tom mentioned, as of May 13th, we've seen 185 confirmed cases of COVID-19 in First Nations community, 16 cases in Nunavik in northern Quebec, and 117 representing the proportion that the Chief Medical Officer stated are considered recovered. We've also been closely monitoring the situation in northwestern Saskatchewan, and to support communities in response to the outbreak, we will be providing $2.3 million in funding, which will go towards the Northwest Saskatchewan Pandemic Response Plan. This pandemic plan is a collective effort between First Nations, Métis, municipal, provincial, and federal partners. Meadow Lake Tribal Council and Métis Nation Saskatchewan have undertaken exemplary collaboration in leading the response to this significant outbreak. The funds will be jointly administered and will complement the ongoing community-based efforts to conquer COVID in the region and support security checkpoints and impacted community measures to address food security, provision of home care supplies, and enhancement of regional and community capacity, which includes youth engagement. We will continue to work with the Northwest Communities Incident Command Center, including provincial health authorities, First Nation and Métis communities in the area to support their efforts through increased access to testing, enhanced surveillance, strong contact tracing, and infection prevention and control measures. We're focused on the health response that will save lives, and I want to reassure Indigenous leadership that we are committed to supporting Indigenous communities and activating their pandemic plans and providing the support in collaboration with provinces and territories that best respond to each community's needs in response to the COVID-19 pandemic. I would also like to give a quick update on Sheshwan First Nation. The Ontario Ministry of Natural Resources and Forestry has advised us that risk of flooding has been downgraded to moderate to low along the Albany River, and this is good news. While the downgrade is encouraging, we stand ready to activate contingency plans if needed. Repatriation of Szechuan residents who are on the land began yesterday, for which we have supported air transportation back to the community to ensure the health and safety of all members. We will continue to work in close coordination with community leadership, the province, Muskegowuk Council, and other federal departments to address concerns related to flooding and plans for evacuation in the area. Lorsqu'il s'agit de combattre la propagation de virus,
when it comes to fighting the spread of this virus, urban and on-reserve First Nations, Inuit, and Métis communities are facing unique challenges. Since the beginning of the pandemic, local organizations as well as Indigenous leadership have been working 24/7 to provide services to Indigenous communities. We know that COVID-19 has placed increased stress on operations for these organizations. In response to these needs, we have taken immediate measures to support these organizations. Through the Indigenous Community Support Fund, $15 million have been earmarked for regional Indigenous organizations as well as urban and on-reserve organizations. These organizations can also receive funds from other federal initiatives under the Economic Response Plan, such as Social Development Canada, and increased funding for women's shelter and centers to help sexual assault victims. Additional funding for food banks have also been placed at the disposal of Indigenous organizations in order to meet urgent needs. In addition to federal funding, individuals and organizations can also support these organizations through charitable donations, and this is critical. However, more support is necessary. We are working with communities to identify the support that they need and the support that they're asking for. And we're working closely with government partners to explore further possibilities to assist urban and on-reserve Indigenous organizations.
I would also like to acknowledge that summer is fast approaching, a time of year that is usually marked by sacred ceremonies and events that are very important to Indigenous peoples across the country. While banning sun dances, potlatches, among other Indigenous cultural and spiritual practices is unfortunately a dark stain on Canada's history, I want to ensure everyone listening that even in the face of a historic pandemic, Canada must not and will not prohibit these important practices. Any decision to cancel or postpone these events is a decision that is solely at the discretion of the community's leadership. I would, however, like to reiterate the importance of the public health measures that we have been repeating since the beginning of this pandemic. Together, we can slow the spread of COVID-19 by making a conscious effort to keep a physical distance between each other, avoiding crowded spaces and contact with people at higher risk, such as elders. First Nations leadership will ultimately decide how to proceed safely in this context, and I would like to encourage leaders to develop guidelines in alignment with the best available public health practice to adapt these ceremonies. In closing, Tuesday marked 150 years since Manitoba joined Confederation under the leadership of Louis Riel and the Métis people. For thousands of years, Manitoba has been home to a number of distinct Indigenous communities, such as the Assiniboine Cree, Ojibwe, Dakota, Dene, and Inuit. The Métis Nation would also form its own distinct culture that would further shape Manitoba's identity and play a pivotal role in establishing Manitoba as part of Confederation. This is an opportunity for Manitobans and all Canadians to reflect on the past and present and to look forward to the bright future of the province. Part of our present and future is walking the path of reconciliation with Indigenous peoples. We must also acknowledge past wrongs and chart a new path forward based on the affirmation of rights, respect, cooperation, and partnership. While COVID-19 is impacting the celebrations that are fitting for such a significant anniversary, we encourage Canadians from coast to coast to coast to learn more about Manitoba's history and culture and to participate in the many virtual Manitoba 150 celebrations and activities being offered online. Miigwech, Nakumik, Marcy, thank you. Merci à tous.
On est maintenant prêt à prendre les questions. Thank you, Minister. We'll start on the phone with 3 questions, then turn to the room. 1 question, 1 follow-up. Opérateur.
Thank you. Merci. If you have a question, please press star 1 on your telephone keypad. Si vous avez une question, faites étoile 1 sur votre téléphone à clavier. The first question is Brett Forrester from APTN National News. Please go ahead. The line is now open.
Hello, everyone. Minister Miller, on May 9th, you encouraged
vigilant, saying remoteness may have delayed the onset of COVID-19 in First Nations, Inuit, and Métis communities. How concerned should we be about a second wave as provinces begin to loosen up restrictions?
We should be very concerned, Brett. As we know, until such time as a vaccine is found and distributed and administered, the risk of second and third waves is very real. And while remoteness has sheltered a number of communities, thanks most importantly to the leadership that medical staff in the community, medical leadership, health officers, and political leadership have ensured, we need to remain vigilant. And the challenge that we all face as a society, as restrictions are lifted, it is very difficult from a political perspective to ask Indigenous peoples to do something that we ourselves would not be prepared to do. And that reflection is very important as we look at the various measures that need to be taken and supporting individual leadership in taking the decisions that are proper to them and that they see are the most important to their communities. And so with that is required a constant dialogue, constant vigilance, and interaction with Indigenous Services Canada, provincial authorities, to make sure that the best medical recommendations are being followed in the community. That will pose with it, as you will recognize, Brett, a number of challenges, whether it is people seeking to come in and out of communities and observing restrictions that aren't necessarily observed in urban settings. And I think that's something that we will be turning our minds to and have started to turn our minds to as we attempt to provide additional supports, air continuity, food security, all supports that Indigenous communities need to weather this global pandemic.
Brett, follow up?
Yep, thank you. We heard at committee that urban Indigenous people often deal with a number of risk factors. Some of them are the same as folks on reserve, such as overcrowding and underlying conditions, among others. What is your message to First Nations, Inuit, and Métis people who live in cities and may be feeling ignored or a bit left behind right now?
Well, as we've traced the chart of this, or the course of this epidemic, Brett, some things are becoming very obvious. One, that this epidemic hits the most vulnerable, particularly those living in crowding conditions, particularly an older segment of the population. And we are learning from this. We know the social determinants of health that have rendered Indigenous communities on a less equal footing than non-Indigenous communities, and that isn't restricted to on reserve. Indeed, in certain urban settings, there are populations that you could say are even more vulnerable. We have deployed, as I mentioned in my speech, $15 million to support, among other things, 94 organizations, the National Friendship Center. We've acknowledged that is absolutely not sufficient. We are working hard to provide additional supports. There are other programs that have been deployed. Minister Monsef, among others, has dedicated a number of financial resources to supporting women's shelters, in particular to support those in need, about $40 million, $10 million of which was dedicated, I would note, to Indigenous shelters on reserve. There are a number of other initiatives. The Verin chez soi, I'm at a loss to translate it in my mind at this point, but also supports for homeless initiatives that have been announced by the Prime Minister, as well as food security initiatives. All this to say, Brett, is that we absolutely acknowledge that this is not enough. There is no way to pinpoint exactly what the outcome of this epidemic will be. And so we stand ready to support, and we will act proactively to support those communities that are best in needs, and the service providers who do a great job with very little resources to support those communities in need.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question, Philippe Vincent.
The next question, Philippe Vincent Choisy from Radio-Canada. Your line is open. Question. Hello, Mr. Miller. My first question is for you. Last week, you said you were concerned about the possible reopening in Montreal. You were concerned about a second wave and an increase in deaths. We recently learned that CMN schools will remain closed until September, and childcare services will be closed until at least the 1st of June. No decision has been made so far about the opening of retail in Montreal. Does this step by the Quebec government reassure you at all? Answer. Thank you, Philippe Vincent. From the beginning, both our Prime Minister and the Quebec Premier have based their political decisions on scientific data. And sometimes these policy decisions have been very difficult to make in real time. We all recognize what is occurring in Montreal, along with the concerns that I expressed about people dying in terrible conditions. That is something that's still occurring, and we're not out of the woods yet. So I congratulate the Legault government on its decision to defer this reopening. Of course, we are still closely monitoring the epidemic curve. Decisions can have an impact in several weeks. This is a virus, so the decisions we make today can have repercussions that won't show up right away, but only in a week or more. If mistakes are made, it's not a matter of blaming people, it's a matter of recognizing that we're all making difficult decisions in real time. And if ultimately it's necessary to change decisions, well, that should be done based on solid data. And I would also like to pay tribute to our Canadian Armed Forces to help people who are in a very vulnerable setting. That work will continue until people find themselves in a safe position once again. I hope that answers the question. Follow-up question? Yes. Another concern. You must have heard from a lot of business people in Montreal, for example, who are saying that the CERB is leading to a situation where some businesses are having trouble rehiring. The wage subsidy may not be as much as they hoped for. My question, will CERB be over after the 4 months? Or are you considering modifying it and making it more flexible after the 4 months are up to encourage people to go back to work? Will the CERB just be completely over after the 4-month period, or are you thinking of modifying it? Answer. In all real-time decision-making, with the type of economic impacts that you described, it's clear that we need to make sure that we can readjust and modify our decisions when we see that there is a situation with perverse incentives. I don't think the people receiving the CERB would necessarily refuse to work. People want to work. Job support was announced a couple of weeks ago, and we need to allow that to have its impact over time, trace the economic effects, and ultimately modify our approach if necessary. Thank you. Next question, please.
Thank you. Merci. The next question is from Andrea Gunn from the Chronicle Herald. Please go ahead. Your line's now open.
Hi, Minister. My question is for Minister Jordan. I am wondering if there needs to be any legislation passed for these benefits for fishers, and if so, how long we can expect to wait, or how long they can expect to wait before they can start seeing money for certain things, such as the wage benefit. And also have a follow-up question.
So there is, thanks, Andrea, for the question. There is no legislation that's required for this. We are working right now around the clock to make sure that we can get these benefits out as quickly as possible, because we know how important it is to make sure that fisheries has the support that they need and that they've been very much looking for. So we're working really hard to make sure that we get that out as quickly as possible.
My second question is will it be available for, like, if somebody doesn't want to go fishing because they're too worried about being in close quarters, they don't have any trusted family members that they're fishing with that they're certain don't have COVID or aren't going to expose them to COVID, will they be available? Will they be eligible for this benefit?
So these benefits are threefold. First of all, to make sure that people who no longer qualify for Fisher's EI are able to use their income from last year in order to continue their EI, as well as making sure that they're able to access the wage subsidy equivalent, that they do not qualify because of the unique nature of their business. And then, of course, having the grant in order to make sure that they can meet the needs that they have immediately to address concerns that they have. It's a $10,000 grant. These are all things we're working on and making sure that people have the supports that they need to go fishing, to make sure for the long term that they're able to collect their EI. It's been something that we heard a lot about from fishers for the last couple of months, and that's why we're making sure that we have those supports in place for them.
Thank you, Minister. We'll now turn to the room, starting with Mr. Gallagher.
Kevin Gallagher with CTV News. My question is for Minister Miller. You've already commented on that $15 million for off-reserve Inuit First Nations Métis is inadequate, but I'd also like you to comment on the judicial review filed by the Congress for Aboriginal Peoples with the Federal Court of Canada saying the funding is inadequate and discriminatory for that same group of people.
Thanks, Kevin. It's an important question. I would like to preface my answer by saying I'm in no position to dictate to any organization how to exercise their legal rights. And so that is absolutely their right, and I respect it. We have moved from the very beginning to distribute money in the urban context to service providers that are on the front lines, and we haven't funded, per se, any national organization as such. And so the question in determining the funding was really to get it out to the people that needed the most at that point in time, knowing that there was a $15 million bucket that Indigenous Services Canada administers. And given that, I would say that CAP did receive an amount of $250,000, and my understanding from committee yesterday that was their intention to return the funds. But that said, I don't have any particular comment on the way they exercise their rights, and indeed that is it is their right to do so.
Can you give me an understanding of the ventilator capacity of First Nations? What is the strategy if there is an increase in cases and hospitalizations that would require that type of medical intervention? It's a major concern in big urban centers, but I imagine that ventilators are very difficult to come by in isolated First Nations.
Thank you for the question. One of the key things that for us, it is so important to make sure that we protect the most vulnerable. The way to approach, the ventilation needs has to be a well thought out planned process. For example, it is very unsafe to have ventilators in nursing stations or in remote areas. Why? Because you need specialists. You need intensive care trained specialists in medicine and in nursing. You need respiratory therapists. Those are all specialists, and they are very hard, to come by to actually be in remote and isolated areas. Even in urban or semi-urban areas, there's a shortage of those specialists. So therefore, the way to approach this is to ensure that we work with provinces and territories to increase the capacity of existing hospitals so that they have more beds, they have more ICU beds, in case that there's a need, to actually use those beds. Also, from a prevention standpoint, in addition to all the public health measures that we've been talking about, also the need to try to identify for high-risk individuals, such as elderly, for example, have a very low threshold to make sure that should they become sick, it would be at the very, very early stage to actually try to actually support them to actually move to a center where it's closer to the hospital should they need that type of tertiary care. Thank you. Yeah.
Is the strategy, though, I'm sorry, is there a strategy it sounds to me that people who are on a remote First Nation that might need that type of medical intervention, a ventilator, they would have to be transported then to a major center. Is that right? So now maybe the major center is probably overstating it, but a hospital that is equipped, right?
That is correct. Yes.
So is that already planned? What's the plan for that? Is that already budgeted for? How would that transportation work? Sorry to But I'm just wondering if you could answer that.
Yeah, that's already been planned for in collaboration with provinces and territories in the provincial healthcare system.
So I think there's a general question I think you're asking about the implementation of a pandemic plan for communities that are more remote or difficult to access. There's about 96 First Nation communities that you can only fly into and 50 Inuit. That's part of a generalized approach when it comes to healthcare generally. There are some communities where it's more advisable to fly out to give birth, for example, or transport out of the community. When you look at the implementation of a pandemic and the plans that are attached to it, the communities have, depending on the capacity, demographics, the number of medical personnel in the community, there's been a concerted approach to figure out when it makes more sense to fly someone out for medical interventions, including use of ventilators. Tom has explained the intricacies around having the personnel that are trained to be able to use those devices. But it's part of a more general discussion and comment. We have a technical briefing actually this afternoon that you're more than welcome to participate to that can go into a little more detail about that, because it's part of a more generalized plan of using hubs and getting people out of those communities as quickly as possible through medevacs and back into more regional health centers where we can have those facilities and the properly trained people to use them, and then get people back into community in a safe way. So I'd encourage you, Kevin, to participate in that if you could.
Thank you, Minister. Just a reminder that you have colleagues waiting on the phone. One question, one follow-up. Sean?
Hello, Sean Kilpatrick from the Canadian Press. My question is for Minister Wilkinson. Most Canadians do not live close enough to national parks and historic sites to be able to visit them without driving far away from their homes. Are you saying that traveling to these places is now okay?
No, that's certainly not what we're saying. What we are saying is that there are many parks that are proximate to places where folks live that traditionally have been places where people go to be able to experience nature, but also just to be out and about. And in this context, being able to do so while they physically distance. So the direction here is we are beginning a very gradual reopening of parks, but the message is you go to the parks that are nearby you. There are many, including Rouge National Park and Bruce and Banff and Jasper and a range of those. Go to the parks that are nearby you and experience that. Use that as part of an appropriate way to think about creating more space for people as we move towards spring and summer to be able to physically distance. But we are not encouraging travel beyond the local area, no.
No follow-up. Thank you.
Okay. Thank you, Minister. We'll go back to the phone. Operator.
Thank you. Merci. La prochaine question est de Mélanie Marquis de La Presse. Votre ligne est ouverte.
Oui, bonjour, merci. Ma question est
Question.
pour Monsieur Miller.
My question is for Mr. Miller. Mr. Miller, since the beginning of the pandemic, it appears quite clear that there are tensions with some Indigenous groups, specifically the Wet'suwet'en. Some elected chiefs are demanding Ms. Bennett's resignation, and they aren't happy about the federal loan to the pipeline developers. Could you tell us more about the current state of reconciliation? Has ultimately that major initiative been put on the back burner because of this crisis?
Merci, Mélanie.
Answer. Thank you, Melanie. We should recall that before the beginning of this pandemic, there was a previous crisis, the rail blockades crisis, then the solidarity with Wet'suwet'en movement.
Et tous les constats que vous avez faits en ce que les gens peuvent conclure sur l'état de la réconciliation.
And you've discussed various things that have occurred with their effects on reconciliation.
Ces clivages à chaque jour avec mon équipe.
With my team, I see the effects of this every day.
Lévy aussi.
And so does Ms. Bennett.
La réconciliation en soi n'est pas forcément linéaire ni facile.
Reconciliation is not linear or easy. What we saw with the rail blockades is that the key point is to dialogue and talk to each other, and that's what leads to progress. in order to avoid armed conflict, as occurred in the past. We need to learn from our mistakes, terrible mistakes that constitute a blot on our history. When I think about all that, I ask myself how we could possibly put these things in the past and move forward. And I would say that that is by dialoguing with people that perhaps, a dialogue between parties that wouldn't necessarily have talked to each other before. But we need to talk to each other. Of course, there are reasons that this has been difficult, but we need to. In the Delgamuukw ruling, the Supreme Court stated that hereditary chiefs have the legal right, that never crystallized during the 2 decades that have passed since. And in fact, still today, that hasn't been clarified. The Memorandum of Understanding signed today gives a sense of the path that could possibly be followed to recognize this right, and does not affect the rights of elected band councils. But it does place them in a difficult position. In fact, everyone is now in a delicate position because we all need to start a governance harmonization process that has ultimately been that hasn't been done for decades. There is a path that will have to be followed, structures that will have to be put in place with Wet'suwet'en hereditary chiefs and band councils. The agreement isn't perfect either, but today is still a historic day. Minister Bennett and Minister Fraser of BC will sign this agreement that hasn't ultimately been agreed on since the Delgamuukw ruling 23 years ago. Follow-up question. Minister Miller, the loan through a federal agency, the Federal Development Bank, well, this loan, can you see how this frustrates and is ultimately fanning the flames that never fully went out, even though they were slightly calmed by the beginning of the pandemic? Well, of course, these points of view existed well before the pandemic. And as you said, the loan was granted by an independent agency, just as you said.
Merci, Monsieur le Ministre. Opérateur, prochaine question, s'il vous plaît.
Merci. Thank you. The next question is from Dylan Robertson from the Winnipeg Free Press. Please go ahead. Your line is now open.
Hi, Minister Miller. Manitoba Hydro plans to double staff at its kiosk mega project site. The Provincial Health Authority approved the plan before Hydro had consulted with the local First Nations. They're worried about an outbreak similar to what we've seen in Alberta and Saskatchewan. Is your government going to intervene?
Thank you, Dylan, and thank you for the question. As you know, this is a discussion between the Manitoba government and the First Nations in question. Clearly, the health and safety of First Nations is not lost on the government of Manitoba. Again, I would ask you to direct further inquiry to the government of Manitoba.
Dylan, follow up.
Good stuff. And a question for Minister Jordan. I wanted to know about inland fisheries. Many of the supports that have been rolled out don't apply to fishers in the prairies. And I'm also wondering what you're going to do about the Freshwater Fish Marketing Corp dealing with a glut of products and, not buying fish from fishers.
So thank you for the question. And the eligibility is going to be based on individual applications. With regards to the Freshwater Fish Marketing Corporation, that's a Crown corporation that makes its decisions independent of government. I recognize that they've had some challenges this year, but we are doing everything we can to support harvesters right across the country, as well as inland fishers as well.
Thank you, Minister. Operator, next question, please.
Thank you. Merci. La prochaine question est de Catherine Lévesque de la Presse canadienne. La parole est à vous.
Oui, merci beaucoup. Ma première question est pour Monsieur Wilkinson.
My first question is for Minister Wilkinson. I would like to hear you answer in French about Parks Canada. If I understand correctly, people can visit parks, but only the parks that are near their homes. So ultimately, this is an open season for everyone who wants to visit national parks. Is that correct?
Oui, c'est correct.
Yes,
c'est
that
la
is
prochaine
correct.
étape pour nous de
This is our next
enlever
step.
quelques étapes pour avoir une situation
We
dans
are moving
laquelle
forward to create a
les
situation
citoyens
where
près
Canadians who live
des parcs
close
nationaux
to
et
national
les
parks
autres aires protégées
and protected
peuvent
areas
avoir l'opportunité
to ensure that these
marcher
Canadians
dans
have
les
the
parcs,
opportunity to
d'avoir
walk in these
une place
parks,
dans laquelle on peut
to have a place to go where they can respect physical distancing.
Mais nous avons dit que on a respecté les règles des provinces.
We are respecting provincial regulations.
Que tous les autres Canadiens, et maintenant, c'est pas le temps pour
We don't think it's
les
time
gens
for
voyager,
all other
très loin
Canadians to
de leur
travel
maison.
at a distance from their
Aujourd'hui,
homes.
c'est une prochaine étape, mais bien
Today
sûr, c'est
represents a step
premièrement pour les gens
forward,
qui vivent près des
but at the moment, only for those who live close to national parks.
Oui, merci beaucoup. And my next question is for Minister Jordan. Can you just explain in a nutshell the difference between the two major things that were announced today? So the benefit of $10,000, I understand that's going to be for self-employed fishers, and what's going to be the difference with the non-repayable grant of $10,000? Is that for those who own a business only? So why the difference between the two, and how are we going to calculate the loss of revenue? Thank you.
Okay, thank you. So first of all, the fish harvesters benefit, because of the way that the fishing enterprises are structured very uniquely, they did not qualify for other programs that we've put in place. So what we're doing is making sure that they're getting the same type of benefit, although through a new program. So the wage subsidy, for example, what they will be able to qualify for under the fish harvester benefit would be equivalent to the wage subsidy. And what they're going to qualify for under the grant is a $10,000 non-repayable amount that they couldn't get because they did not qualify for the business account.
Thank you, Minister. And today's bonus question goes to Mike from Global.
Thank you, Mr. Miller. I spent some time in the Northwest Territories, so I understand the medical travel thing a bit. Has it changed anything really from what normal situations are? Have we added more money to it? Or is it, if you're sick, we send you to Yellowknife, we get you out of your community, we send you there. If you're pregnant, we take you to Yellowknife. If you got COVID, we take you to Yellowknife. Is that the same procedure we've always had?
Well, maybe ask Tom to follow up on this because it's a very important question. I mean, obviously a global pandemic changes the risk profile you take in evacuating people and even moreover bringing medical personnel into communities and what elements you treat in community, what ones you postpone. So it has changed things and it's put an immense pressure both on territories and on the airlines that serve them, as well as on how we profile the risk. And so whether it's decisions that need to be taken with respect to making sure that the personnel coming in and out, which is there to serve the people, don't spread something, which we're very, very conscious of, and we've done so with respect to flying First Nations with Indigenous Services Canada charters to make sure that we're transporting personnel and food, equipment in the safest way possible. But also the decisions that are taken by the territories. And as you know, the territories take the decisions with respect to the airlines, but we've provided them monetary support we've provided them support in terms of how we co-pay with Nunavut in particular, and how FNIB fills the spaces that are necessary for those airlines. And obviously those airlines are seeing a drop in some of the travel that they would take, and it also influences the number of people or federal officials that we send up, and the people and transport in community that are transported out of community for medical intervention. So the answer is yes, it has. We haven't fully appreciated the distortions that it's created. Obviously, it's created a need for more remote health guidance, telehealth, more nurses in community when we've seen potential cases break out, and the need to deploy rapidly on an emergency basis based on the unique risk faced by COVID. But I would say absolutely, yeah, it has created a number of considerations that obviously no normal person could foresee, but it also has created the need to be ready with regional hubs to go in and out and have testing centers in different areas as opposed to flying samples into Ontario or into the national lab in Winnipeg, having something in Iqaluit, for example, so that we can get those tests back quickly, because if you have a negative test, you want to be able to give that person reassurance that the test is negative and not have to ramp up your intervention. So it has in many ways. I think I could go on for a long time, but I'll pass it over to Tom, who actually has a medical degree.
Yes, indeed. We support the territories in their formulation of the plan and execution of the plan, and when it's needed, we offer additional support, such as recently, when there's a need, to have extra capacity for on-site rapid testing. We work with the territories to provide that. So likewise, for any other needs, including transportation, medevac, building on existing infrastructure, existing processes, we are there standing behind First Nations, Métis, and Inuit communities wherever they live across Canada in order to support them, in order to protect the optimal protection for their security and for their health. Thank you.
Okay, thank you. And the next question I have is about healthcare staff. A lot of times there's locums, they go up for 2 weeks, they come back, they alternate, and we have a constant wheel of healthcare people coming in and out of these communities. Has that changed in any way? Have we put in different strategies to protect both healthcare workers and the communities?
I'll speak generally to it. I mean, we've examined a suite of options, including extending contracts, making sure that we have more robust health procedures and screening. The testing, as you know, point of sight is not at the point where we can actually get the type of result back where we could get within a very, very short period of time the assurance that the person going in is completely negative. But as we've said with all testing, it has to be surrounded by a suite of other tools that we examine and precautions we take with respect to screening. It makes screening much more important. The dedicated air service that we've done for First Nations flying communities, the supports we've provided to territories to surround personnel, and the surge capacity that we've provided. But I think I'd ask Dr. Wong to continue on that.
In the north, the reality is very different than in the south, and each community and each territory will make their own decisions, working with all the partners to say what is the best. And for some, it's making sure that folks, including healthcare workers or essential workers from the south, they self-isolate for 14 days before they actually go to start working. For others, it's a modification, of that. And the bottom line is that communities want to make sure that the healthcare workers that are coming in, they don't bring the virus into the community. And each community works very differently in how they execute the plan.
Thank you, Doctor. Voici tout ce qui met fin à la conférence de presse pour aujourd'hui. Merci. Thank you.
Thank you. The conference has now ended. Please disconnect your lines at this time, and we thank you.